Sure. So the vast majority, so an ectopic pregnancy is when the little munchkin, because of usually tubal disease, I mean, I think your audience understands there's a birth canal. At the top of the birth canal in the woman is a cervix. The cervix is the garage door to the womb, the uterus. At the top of the uterus are two little highways, tubes, that go about 3 or 4 inches, maybe 5 in big cases, all the way to the ovaries. And there's ligaments that hold all this up. And the ova, once a month, usually when you're having most of the mucus in your cycle, which is what fertility awareness-based methods, they can identify your day of ovulation about 30% accurate, but they can really narrow it down to those few days. And the methods are excellent today, thank God. We have this group called Fairfax that is just tremendous with Dr. Marguerite Duane. That's excellent with understanding this. But the egg comes from the ova, from the ovary. It gets released. The husband and wife have relations. Millions of sperm start getting into the cervix where they're being fed by the mucus. They're kind of waiting. And then a few of them will kind of shoot up into the uterine cavity and then get into the tube. If there's no ovary there, if there's no egg rolling down the tube, they die. The sperm die. But if it meets in the tube, the egg and sperm come together. That's in the 2/3 to the end of the tube. That's where conception occurs. That's where fertilization occurs. It takes about 5 to 7 days to get down the tube into the uterus. But guess what? Sometimes there's scar tissue from infections. Sometimes the little hairs are kind of out of sync. And all of a sudden, the 2, 4, 10, 50 cell embryo, the blastocyst, starts growing in the tube. And the placenta starts growing in the tube. Well, there's not a lot of blood supply to the tube. But what does a placenta want? A placenta just wants to keep the baby alive. And so it'll start growing, and the tube will, and you begin to have spotting. The woman has pain in her side. But it's very similar to other things. So you need a really good doctor to look at you, examine you, use some testing with blood tests to figure out where is this new person growing. At first, it's only the chemical you follow. So it's a challenge. The vast majority of the time, the baby's already dead because the lining of the tube is not, once the baby's dead, what? It's not an elective abortion. In rare cases, there is a heartbeat. And I'm telling you, I have had phone calls from emergency rooms all across the country where a young resident's going, "Hey, John, I've got this, it's terrible. My heart's breaking, but we need to fix this." So there are many ways to treat this. And a lot of times people will just, and this is morally challenging. There's good people on both sides of this issue.
And you have the principle of double effect that you're trying to pull into play.
Well,
that's exactly
pull into play. No, Colleen, you're exactly right. You have to have that in your soul. You have to be so comfortable, but so reverent, because you're walking on holy ground again. So in our case, we remove the diseased tube with the baby inside. Now, some people are trying, well, can you maybe transfer it to the uterus? Still in its infant stages. I don't do that in regular OB/GYN. I'm leaving that for people who are much smarter in the research areas. So we remove the tube with the disease in it. And we're finding out data-wise that that's a pretty good thing to do. Because in some cases, we have to make the incision. You just open the tube up above on the side that's not connected to the blood supply, and you use high water pressure to pop out the fetus that's alive. I've done those in my past. I don't do them anymore.
That's the one that's morally questionable, morally wrong. I'm not sure.
Right, but it's such, well,
it's a lot of gray area.
Once again, this is really, but once again, the enemy it's a lie. Our Father in heaven is a liar. That's what Eve and Adam thought. That's the original sin. Can't trust him. He's not good enough. He doesn't want you like him. It's a lie. The big lie in medicine today is that abortion is good medicine. And they're going to use every word like abortion without elective or therapeutic because they can't even speak the word. They're just trying to, oh, no, it's just part of abortion. Well, no, it's not. It's elective abortion. It's when you directly intend the death of the child.